Welcome to the CEO Insider Podcast powered by YTexas. My name is Sandy McIlree along with Ed Curtis, and we are continuing our series of talking to different companies around the state of Texas and how they're handling the COVID-19 pandemic. And we have an exciting guest with a background in healthcare, two guests actually, to talk to today. Ed, tell everybody who we're going to be chatting with. I'm excited to get into this.
Yeah, you know, the corporate social responsibility that we've been talking about that's happening around the state and around the country has just been remarkable. And we've got two folks here from HKS, Dan Noble, the CEO, and Jason Schroer, who runs their healthcare division here in the Dallas office. This is an amazing story. I want to give a little background before we dig into this, but essentially the story is this architectural firm is converting hotels, schools, other convention center type of facilities into hospitals in less than 10 days. And there's a long history behind how they got here. HKS is over an 80-year-old company here in the Dallas-Fort Worth area. They have, they're the third largest architectural firm in the country that focuses solely on architecture. They have specialty in a number of different areas. Healthcare, they've worked on MD Anderson, Children's Hospital up in North Dallas. In the entertainment side, Globe Life Field, American Airlines Center. So they've got a long history of doing big projects. So I'm excited about this. And I'm going to start with Dan because Dan, you know, he's been at the helm for the last 6 years or so at HKS. And this is not your first rodeo in big projects and big ideas like this. So just give us a little background on what's happening at HKS and kind of how you got to this situation.
Yeah, all right. Well, I think I'll start with what put us in a position to be able to help our communities in times like this. We've been through a strategic plan reboot, which we do about every 5 years anyway. We typically look at try to create a 10-year plan, but you can't ever really understand what's going on 10 years. So we break it up into a 3, 5, and 10 year. And really focus on the 3 and 5 year. In the last exercise we went through, we decided that a lot that was happening in the design community was being commoditized. And really what we had to offer the community had more to do with, with what we do typically in basic services in the architecture and design field, but also the fact that we see things and we have specialties, as you mentioned, Ed, in the practices of health, sports, hospitality, education, mission critical. You know, we have a lot of specialties that give us insight into the inner workings of a lot of the businesses we deal with. And we also have groups within the firm that are advisory groups, consulting groups, research and development arms. We have a group called Citizen HKS, which does pro bono work throughout the world. Each year, we dedicate about 5% of our profits to pro bono work and research and development. So what we were doing with that was seeing that, you know, if we want to be more than just an architecture firm, we should focus equally on ideas. And we have a mission statement that through limitless thinking, we will be the most influential firm in the industry. And to do that, we talk about leading with knowledge, number 1, advising for influence, number 2, and outcome-driven design, number 3. And what that does for us is it gives us a cadre of people within each of our sectors that know the industry as well as how to design for it. And it allows us to help our communities, help our neighbors, help the profession, share in our knowledge, share in the research that we do to create a better world. And when things that have, like what we're, the pandemic that we're, within right now, it gives us the opportunity to utilize some of that knowledge and to cross-pollinate that knowledge, say, between hospitality and health, between sports and health, between convention centers and health, between crowd control that we know through the sports industry, and how we develop urban design going forward. And we have a strong urban design group that's really looking into the idea of how do you handle density while you're still, trying to struggle with isolation. We have a group that's put a lot of effort into loneliness and isolation, and how do people grapple with the idea of loneliness? How do extroverts, operate in a time like this? We have probably, this isn't a scientific number yet, I don't know for sure, but I think we've published about 15 articles in the past 2 weeks on the subject that deal directly or indirectly with the coronavirus and how people are responding to it. But to your point and to what this podcast is about, we've really put a lot of emphasis on surge and the need for triage in healthcare and treatment in healthcare. And Jason Schroer has been at the tip of that spear in helping us determine how we can help. We have 24 offices worldwide, 1,500 people worldwide, and we have the ability to really make an impact in our communities. And Jason, as I said, has been at the forefront. So I might ask him what he sees and what we've been doing directly on the health side of things.
Dan's exactly right. Dan has afforded us through his vision and through the vision we share, the ability for us to learn and to kind of share our ideas through kind of a charitable heart, so to speak. And specific to the current crisis, we wanted to think about what can we use our core competencies for the better good. And when it comes to design, planning, the ideas of architecture, we wanted to really think about how can we leverage that talent and that knowledge to help. And so it really started with a quick conversation when we started seeing these pop-up tents, come on hospital campuses and in soccer fields. We started to ask ourselves, there's got to be a better solution than a tent, right? Mm-hmm. To help alleviate the bed shortage that was predicted through the surge of COVID. And so as we jumped into some thinking on that, we brought in our partners and our experts from our hospitality group who know hotels, backwards and forwards. And we started a quick think tank, and it kind of was then born into this idea of utilizing existing buildings that may not be health buildings, but could be easily converted to patient care to support any surge that might be needed for the bed shortage. And then we investigated schools, and then, as Dan mentioned too, assembly and venue spaces as well. But jumped into that, and we were in a very open share thought and idea kind of way in which these weren't intellectual property to us. We wanted to share these ideas. If it could help somebody somewhere, then we were happy that those ideas could spur a solution.
Jason, you mentioned quickly and easily converting these spaces to hospitals. How long? I'm sure it varies upon size, but in general, how long would it take to do?
Yeah, so we have some experts in-house that are healthcare administrator experts. That's their background. They're a part of our consulting team, and they were able to provide us some ideas as to what it would take to actually mobilize, let's say, a healthcare team. We also spoke to some of our friends in the industry specific to construction. And the building types that we tried to focus on were those that would take minimal conversion, so to speak. Like, there may be some temporary partitions that need to be put up. There may be some tweaking to the mechanical systems that need to happen. But generally speaking, you could almost use these buildings as is to support patient care. Mm-hmm. Now, we had to concede that in all these cases, you're not going to be converting these to the point where you can call them a hospital. Mm-hmm. It's just impossible from a life safety perspective and a mechanical perspective. So as we began to jump into this more deeply, the CDC along the way in the midst of our study began to define different patient types in different sites. And they coined a tier 1, tier 2, and tier 3 kind of site or patient. Tier 3 is the highest acuity, the patients that are going to need ventilation, high observation. The solutions that we proposed were really geared more towards those tier 1, tier 2 patients that may not need this high level of care, but they need to be sequestered, or they are in a place where they can't care for themselves, or they have family members at home that are at high risk. And so give them the ability to be in a place where they could have the care that's needed. They'd have food service as needed. They would be pulled kind of out of the way in which they would be potentially passing, the virus on to others, and sequestered in these places. And we determined that through our discussions on hotels, there's different types of hotels. We determined a full service convention center hotel would provide the most flexibility for patient care. Because of one, the patient rooms can easily be used as, the guest rooms can easily be used as patient rooms, and the ballrooms can be used as those open wards, which I know we've all seen pictures, right, of conversions of some of these convention centers.
Mm-hmm.
But the idea of an open ward allows you to cohort not only staff, highly trained staff, but patients to be more efficiently used, because really the pinch point in all this is staffing. You may be able to build these places, but you still have to staff them appropriately. So that was going to be the pinch point all along.
Dan, I'm curious. HKS has, everyone's trying to stay in business too. And how much of your workforce do you take and say, okay, guys, this is your focus? Or do you peel them off of other projects and put them onto this? And what does that look like for HKS?
Yeah, Sandy, it's kind of a combination of both. So much of what we do is collaborative anyway. I mentioned earlier that we have 24 offices, but we're one profit center, so we work as one. So we've always worked, in a sense, remotely. We've been in our offices, but we share information, with people in Shanghai or London or Mexico or New York. So we're adept at working remotely. So when we went remote, really 5 weeks ago now, we didn't skip a beat. So it's very easy for us to work remote. When I say easy, you always miss the social interaction and the hands-on collaboration, and that's never going to go away. But, in a pinch, we can definitely work like this. So we also saw that there was a need. And as I mentioned earlier, with our strategic initiative to do better, to help our communities and to make a difference, a positive difference, we dedicate, and we still have work going on. We've lost a portion of our work in our revenue stream. Mostly that's in the commercial and hospitality side, but our healthcare people are very busy. So to pull this off, it was done in overtime. And most people that were working 8 to 10 hours a day are now working 16 hours a day to get over this hump and to get us into a position where we could help our clients. So it was something that people did, out of passion, out of commitment, and out of, architects in general are a passionate group, and they got into the industry to help, to do better, to make a difference. Mm-hmm. And it's times like this that give us that opportunity to really kind of practice what we preach. So most of it was done in overtime. There were some people that were probably coming off of jobs. And again, we have a research group this is a part of what they do. We have our consulting group, our advisory group. This is a part of what they do. So some of it was part of their job and some of it was done in overtime.
It almost sounds like this is a result of a really good culture at HKS to have those type of people that are doing it out of a kind of a sense of duty.
Yeah, definitely. We've had Citizen HKS, which is I mentioned earlier, part of our group that does pro bono work around the world. We've done sensory deprivation or sensory nodes within schools, Lane Tech in the Chicago area, to help kids with learning disabilities. Mm-hmm. We did a maternity ward in Kachambawa, Africa, to help with the delivery process of mothers and children who were, the infant mortality rate was through the roof. So we've for the past decade been involved in many things that help the communities. And I got to tell you, the millennials that have come into the office really bring that sense of community and the desire to do better, to do good by the community. They bring it with them. It's part of their culture, and it's infused our culture. And it's not like it They were pushing the leadership. The leadership in our firm felt that way anyway. We've always had a strong leadership that wanted to give back, that felt that, that's a duty as a society that's connected. And so it is, Sandy, it is part of our culture. I think it's only grown stronger. And I actually think that the sort of the, want to call it the pickle we find ourselves in now through this isolation and the coronavirus and what it's done to the economy, I think that's brought us closer, and that's strengthened our culture. And I think a lot of the people in the group, in our team, who, were wondering how do we demonstrate that culture, are now seeing it in action and seeing that we are walking the talk, and we're committed to this.
Yeah. Well, we're on April 16th now, and I feel like we always have to mention the day because things are changing by the minute. And some cities are experiencing, more activity than others. I would imagine, I know you're doing this kind of nationwide. As we kind of hopefully get out of this and get back to work, maybe over the next couple of weeks or month, is there any specific part of the country that you're putting a lot more focus on now?
Well, the coasts have been obviously hit and suffered the worst. New York, by far that New York area. When you look at places like Texas, for instance, the incidence per capita is very small of both the catching the disease and the mortality rate, very small. Even California, that acted early, is seeing per capita less incidence. Our Shanghai office of 60 people is up and running. Everybody's in the office, everybody's operating. The London office is probably they really rely on mass transit in London, and those kinds of issues are going to be with us for a while. We're looking at the areas, so in Dallas, for instance, we're going to be this separation mode through April, and it may continue through May. But then we'll probably do things like rolling starts, where we keep a bit of isolation in the offices. We'll see what communities are responding intelligently, and those that are, will allow our staff to venture out. Those that are in areas where there hasn't been a lot of sort of precautions taken for safety, we'll be more cautious about opening it up. But in any event, when we do open up, we'll be doing it staggered. We'll have things in place in our offices. We'll make sure that the owners of our buildings, landlords, are taking precautions. If they aren't, we'll respond accordingly. So, Ed, we've been so much right now in the mode of response to what's going on that we just this week started brainstorming on our response going open, and what's our reboot look like, what does our restart look like, and how do we handle these things I just mentioned. It's going to be different everywhere. There's not going to be a one size fits all for this, but what will be consistent is that we want to ensure the safety of our staff. And as I said earlier, we've proven we can work remotely, so we're not in a hurry to rush back to save our business. If anything, we would just be in a hurry to rush back for the sanity of the people that have been in isolation, and it's driving them nuts.
Yeah. And Jason, you have to be thinking about the future. We're all planning for, if this ever happens again, we'll be a lot more prepared next time. How would a concept like this, converting these facilities within 10 days into a hospital, how does that play into your future plans in the event it happens again?
Yeah, we've already had some conversations across all sectors in the firm of kind of the what if, and even as simple as for our hospitality group, most hotel rooms currently, let's just say, practically have carpet in their rooms, right? Do you begin to design rooms that have more resilient finishes, such as a hard surface floor, so that a conversion like that, should it be needed down the road, would be a little easier to make. So just simple, small discussions like that are being had in terms of how it might impact planning and design moving forward with all building types, stadiums, some of our convention center work, schools for that matter. Are there things that we can do up front through infrastructure that can help us flex these buildings a little more effectively down the road? And there's no doubt that in terms of hospitals specifically, that there'll be some changes on how we begin to plan and design hospitals, specifically around their ability to flex and surge or not, and being sure that we provide the infrastructure to do so in the case that we need it again.
Yeah. And Dan touched on this a little bit. Beyond the architecture and design, you're also looking into the disinfecting and really more of the biological aspect of it. Are you digging into that as well for future projects?
Yeah, I think we actually have a task force already that's our infection prevention task force. We actually have some scientists and researchers and from the health side, nurse practitioners on our team that have high familiarity with, the idea and the science behind infection prevention. And we feel like that the baseline science needs to inform us as we move forward and advise our clients, on what impact that might have on design decisions in all building types as we move forward. So there's no doubt that thread will be, throughout all of our building types moving forward.
Wow.
Yeah, I feel like you would have to assure the buildings that you're going to be converting that it will be able to be sanitized when this is done. I feel like that would be they might get some pushback from the public afterwards.
Yeah. Right. And, this extends into other building types. Like we've been having conversations about what does the workplace look like. And some of our commercial clients who develop office buildings are wondering, we've always talked about the ability to work remotely, but this has actually shown us that, yeah, we can do it. Mm-hmm. And they're a little bit concerned that the demand for office space and their clients' real estate footprint will shrink. And, there's probably going to be some of that. But on the other hand, for the past 10 years, we've been looking at more and more density in the office space. Now, what's happening here may say, and we've also been talking about hoteling, where people share the same desk. They just work in a rotating fashion. But it may be that people don't want to share a desk anymore. It may be that we instead of having 180 square feet per person in a space, we're looking at 200 square feet per person in a space. Less people, more people working remotely, but those people that do come in, they have more space. There may be more space for, quiet rooms or restrooms, more space in the public areas so that we can distance ourselves. I've read where restaurants are talking about reopening, but taking out every other table to encourage social distancing. So, we may be seeing we will be seeing a shift. I mean, we will be seeing an enormous shift. And we'll be having a lot of people that need to weigh in on this, and which is what I was getting back earlier. I think architects and designers are in a unique position to be a part of that conversation, to lend some leadership into that conversation, and to help with a solution that is, effective in doing what we all want to do, which is keep our community safe.
You guys are doing great work. I think it's really impressive that you're doing this. So for me, and I think for a lot of people listening, thanks. We appreciate it.
Absolutely. Thank you.
Thank you.
Yeah, this is, we really appreciate you coming on. We've had tons of stories from companies in different industries, just innovating. And this HKS story is just another one, I think, that's going to make a big impact on things.
Yeah. Appreciate that.
Thanks,
we're trying. Thank you.
All right, Dan, Jason, be safe. Take care of yourselves. And we'll see you soon, hopefully, in person.
Good
deal. Yeah, absolutely. Let's do that.
Thanks, Sandy. Thanks, Ed.
Thanks, guys.
Thank you. All right. Bye-bye.
Take care.
Bye.
See you.
A couple of guys, in North Texas that doing a tremendous work there, Ed, and really seeing the big picture and getting after it. Not just there, but globally, actually. They're doing a lot.
Yeah, impact all over the world. That HKS has been doing remarkable things for a long time, but there's them stepping up with this idea. I mean, converting these places into a hospital in 10 days is definitely needed in other parts of the country. I think Texas, we're doing okay, but some of these other cities are getting hit pretty hard.
Right, that's true. Make sure you stay up to date with all things by going to YTexas.com. Also to our Facebook page. You can just search YTexas. Ed, we'll talk to you again soon.
All right, Sandy, you too.